In response to COVID-19, the government of Belize has implemented strict guidelines on persons to practice social distancing to reduce the spread and risk of getting COVID-19. Practicing social distancing is when one maintains a greater than usual distance away from another person. In public health, it is a practice to prevent sick persons from coming in close contact with healthy people. Recent studies are showing that social distance of 3 feet or more decreases the exposure of COVID-19. Before these restrictions, a person with COVID-19 could infect 2.5 persons in 5 days, 406 persons in 30 days. When you put into practice measures to reduce the exposure activities by half of that one infected person, in 5 days you would possibly only infect 1.25. 30 days, 15 persons. Reduce the exposure of that infected person by 75%. In 5 days, you infect 0.625. In 30 days, 2.5 persons. Remember, the virus does not move on its own. People move it. The more space between you and others, the harder it is for the virus to spread. A health and wellness message from your Ministry of Health. If you have been directly exposed to the new coronavirus or have a history of travel in infected populated areas, it is recommended that you self-quarantine. Identify a room to be used to self-quarantine and limit contact with healthy persons. Keep away from older persons and persons who have medical conditions that affects their immune system. Monitor for any cold or flu-like symptom for up to 21 days and wash hands frequently with soap and water. If you become seriously ill, call your healthcare provider or 0800-664-2273 for guidance. A health and wellness message from your Ministry of Health. Persons at risk of becoming seriously ill from the flu or the coronavirus. People over the age of 60, persons with medical conditions they already had, such as diabetes or heart disease or conditions that has made their immune system low, such as HIV or cancers. At this time, there is no vaccine or treatment. Serious cases may need oxygen or ventilator support. Be caring and show support for your elderly loved one during this time. A health and wellness message from your Ministry of Health. Reduce your risk of viral illness like the flu or the coronavirus. Wash your hands frequently with soap and water or with an alcohol-based hand sanitizer. Cover your nose and mouth when coughing or sneezing with a tissue. Throw away, then wash hands immediately. Avoid close contact with anyone who has the cold or flu-like symptoms. If you become ill, please visit your doctor or nearest health center and share your travel history. A health and wellness message from your Ministry of Health. Get information from a respectable international or official local source. When in doubt of COVID-19 information, verify before sharing or repeating the information. Prepare for COVID-19 with an easy plan of action for yourself and your family to put into practice to avoid or reduce the spread of the illness. Be calm and continue to stay informed of the developments of COVID-19. Adjust your plans where necessary based on official advisories. Your local health authority can provide the best information on whether COVID-19 is spreading in your area. If you become seriously ill with cold or flu-like symptoms, please contact your doctor or nearest health center. For more information, contact the Ministry of Health at our toll-free number 0800-MOH-CARE or through our Facebook pages, the Ministry of Health Belize or the Office of the Director of Health Services. We are here to help you. A health and wellness message from your Ministry of Health.
Border jumping is illegal and
if you have a cough or a sneeze, cover up to the right thing, please. Wash your hands properly. Wash your hands regularly. Soap and water is all you need to scrub and rub naturally.
Belizeans love fresh fruits and vegetables. If you will be heading to the market to stock up, please be sure to do so safely. Be sure to sanitize your hands at sanitizing stations provided at the market. Limit your time at the market by planning ahead and making a list. Once there, be sure to adhere to 6 feet social distancing at all times. Purchasing pre-packaged produce helps to avoid touching produce that other people have touched. Sanitize your hands often, especially after conducting monetary exchanges or touching surfaces. If driving, you should place purchased goods in a designated tray within the vehicle. When you reach home, properly sanitize your reusable bags. It's also advisable to properly wash and dry your produce before consuming or storing them. The Belize Marketing and Development Corporation, Ministry of Health, and market managers encourage all Belizeans to keep safe and buy local.
The uncertainties surrounding coronavirus disease may be stressful for children. They may react to fear and anxiety, which may lead to negative changes in their daily activities and behavior as a natural response to a stressful event. Some changes to watch out for in children include excessive crying or acting calmly and confidently, as children in part react based on what they see from the adults around them. This is a message from the Ministry of Health.
How to put on and take off a mask. Wash your hands with soap and water for at least 20 seconds. Dry your hands with a clean paper towel and throw the paper towel away. Check the mask for any defects such as a tear or missing tie or ear loop. Throw away any that are defective. Make sure the exterior side of the mask is facing out away from your face. Place the mask completely over your nose and mouth. If the mask has ear loops, put those on top of each ear. If the mask has ties, pick up the mask by the ties and tie the upper ties behind your head with a bow. If the mask has a lower tie, then once the mask is fitted to the bridge of your nose, tie the lower ties behind your head with a bow. Make sure the mask is completely secure. Make sure it covers your nose and mouth so that the bottom edge is under your chin. Wash your hands again with soap and water for no less than 20 seconds. Removing the mask. Wash your hands before removing the mask. Do not touch the inside of the mask. It may be contaminated from your breathing, coughing, or sneezing. Untie or remove the ear loops and remove the mask by the straps. Throw the mask in the trash. Wash your hands again to complete the removal. Note, cloth mask blocks some but not all airborne coronavirus. Social distancing and frequent hand washing are still your primary protection measures. A health and wellness message from your Ministry of Health.
In response to COVID-19, the government of Belize has implemented strict guidelines on persons to practice social distancing to reduce the spread and risk of getting COVID-19. Practicing social distancing is when one maintains a greater than usual distance away from another person. In public health, it is a practice to prevent sick persons from coming in close contact with healthy people. Recent studies are showing that social distance of 3 feet or more decreases the exposure of COVID-19. Before these restrictions, a person with COVID-19 could infect 2.5 persons in 5 days, 406 persons in 30 days. When you put into practice measures to reduce
If you have a cough or a sneeze, cover up to the right thing, please. Boys and girls, the entire family, help protect the weak country. Wash your hands properly. Wash your hands regularly. Soap and water is all you need to scrub and rub naturally. Coronavirus, seriously, it took over the world practically. Sealing lives with no remedy. Yeah, make everybody be up cautiously. Boys and girls, the entire family, help protect the weak country. Wash your hands properly. Wash your hands regularly. Soap and water is all you need to scrub and rub naturally.
Belizeans love fresh fruits and vegetables. If you will be heading to the market to stock up, please be sure to do so safely. Be sure to sanitize your hands at sanitizing stations provided at the market. Limit your time at the market by planning ahead and making a list. Once there, be sure to adhere to 6 feet social distancing at all times. Purchasing pre-packaged produce helps you avoid touching produce that other people have touched. Sanitize your hands often, especially after conducting monetary exchanges or touching surfaces. If driving, you should place purchased goods in a designated tray within the vehicle. When you reach home, properly sanitize your reusable bags. It's also advisable to properly wash and dry your produce before consuming or storing them. The Belize Marketing and Development Corporation Ministry of Health and market managers encourage all Belizeans to keep safe and buy local.
The uncertainties surrounding coronavirus disease may be stressful for children. They may react to fear and anxiety, which may lead to negative changes.
I think this is what, take 3 now. I hope you can hear us now. Sorry, folks, those are technical glitches. I don't know if we have any control over those, but we'll go ahead and get restarted. As I said, I'm going to be reading and following up through notes, so you will excuse me for a delay in some of the notes I'm going to be giving you, because there is a lot of information that I need to bring across, and beyond just information, so that you are aware and can continue to appreciate the work that's happening behind the scenes in terms of the Ministry of Health. So I'll have it broken down by topics, and I think that once we go through them, most of the questions should be answered that have been coming to us through the different platforms in terms of questions. One of the first notes I need to go on is in terms of the airport process and how that has worked out. Routinely now we have flights from Thursdays to Mondays. Tuesdays and Wednesdays there is no flight coming in from the US. Private flights may still be coming in, but those are perhaps easier to handle in terms of numbers. So the first day that the airport was open, which was last week, Thursday, October 1st, there was one flight coming in that came in. Friday to Sunday there were two flights, one from Houston and one from Miami, and on Monday there was one flight. And we understand that the flights from Miami will be coming at least for the month of October from Thursday to Monday, and from Houston from Friday to Sunday. So the total amount of passengers that came on the flights from Thursday to Monday was, on Thursday there were 73 passengers, Friday 220, Saturday 218, Sunday 192, and Monday 73 passengers. That's a total of 776 persons arriving in the first 5 days. The majority of these persons returning are actually Belizeans coming back home, and I think we need to stress that because there's the balance and situation of what was going to happen if tourists started arriving. Out of the 776 persons, 372 of those were screened at the airport with the SD biosensor test, and some of those persons were also randomly tested via a PCR platform. The rest of the persons that were not swabbed, and that was determined also by the quarantine officer at the airport, is because they brought in a PCR test result that could have been validated, and that's why for some persons it's an easier process to go through that airport situation. I can tell you that the flow process, I personally thought it was going to be a much more delayed process than it was. It went much smoother than we had anticipated, at least from my vantage point, that it was going to be. Understand that there are some glitches that still need to be fixed, and the team is, as we speak, doing further training with the Central Health Region to try to address all those situations as we move along. Out of all those persons tested, we did have one person that turned out positive. That person was picked up on Sunday via the rapid test that has been confirmed by the PCR platform. So that person remains under quarantine at a hotel in Belize City, and that is part of what is in the regulations. As you will note, is once you are tested positive, then you will be placed in a hotel quarantine at the discretion of the quarantine authority, and at the hotels that have been identified in Belize City. That's why also the quarantine officers, the doctors, and the senior officers that are at the airport will determine also what relevance in terms of testing and what symptoms they will specifically go and look for. And as I said, that's part of the protocols and mechanisms that are set in place as we move along. Understandably, as we move along, the process flows and situations will change. We're hoping to make it more dynamic, more fluid, but it is what it is up until now. And as with all things related to COVID-19, it is expected that you're going to have changes in terms of what it is that you are doing at the different levels. In terms of what's happening at the airport, and I will go to the new SI number 136 of 2020, because I need to cite a particular note of it that I think we are tending to bypass, and we have been getting complaints on social media platforms or calls to the different numbers that we have, because that SI is enforceable at all times. There are elements for tourists, for returning Belizeans, for business persons, for qualified retiree program persons, and for long-term persons who have a home here in Belize. Understand that the issues in terms of mask wearing and physical distancing have not been lifted. The issue of not having more than 10 persons in a particular meeting area, that those things still remain and become enforceable at all times. I will cite particularly this because once you have been cleared by the airport health officials in terms of you not requiring, you either brought a negative PCR or you turned out to have a negative rapid test, it does not mean that you are totally in the clear. And I will read the specific SI that is outsigned from last week Friday. In portion 21, it says, and I'm reading verbatim what it says: for the purposes of preventing, controlling, containing, and suppressing the spread of the infectious disease COVID-19, every Belizean permanent resident, holder of a valid work permit, qualified retired person, foreign homeowner, or long-staying non-national who enters Belize through the airport shall be subjected to self-quarantine by remaining in his place of abode or other place and physically isolating himself from all other persons for a period of 10 days from the day after his arrival at the airport. And I'm stressing this because it is clearly articulated in the SI, it is clearly enforceable at all times, and because the complaints have been coming particularly from the Placencia Peninsula that people have not been adhering to this. And so as we move along, we intend to take all the avenues that are necessary to make sure that this is adhered to at all times. And we are still working very closely with the police and other relevant entities to make sure that this becomes enforceable. And in that same SI, it clearly states what happens once you break the quarantine orders. So I think it needs to be clear that everybody who has been cleared from the airport needs to be physically isolating themselves for at least 10 days after you have left that airport. So it's not only for the ones that are positive. We are also saying this because we have notes of people who arrived and went to wakes, went to home parties, went to greet family members who they have not seen in months, and that is not anticipated to continue to happen. Now this is specific to the airport. We are reviewing what the process is at the land border entry points, and we are trying to also cut back on the time that people will have to wait at the border entry points. If you're bringing in a PCR, your process is going to be much quicker. Understand that we don't do routine swabbing and screening at the border entry points, and that's where that's why you will have a delay by the time you are swabbed and that process comes to Belize City. So you will have to be paying some hotel time at whether you're coming in through the western or the northern border entry points. So that's what is specific to the airport situation. We have modified the quarantine form. So that quarantine form is going to be printed, and people will now be asked to sign on to it at upon arrival at the airport, because we'll keep a copy and where your physical address is. Understand that once you have broken the specific quarantine cited here, there's a note in there that we will be sharing that information with the relevant authorities so that we are able to enforce the quarantine measure that is clearly stipulated here. The other item that's on the other subtopic I have in terms of discussion is what has been happening at the prison situation at the Colby. I believe you saw towards the end of last week that we had initially 4 prison officers had been documented to have tested positive for SARS-CoV-2. A team went up there yesterday, and there's another team that went up to help Colby health officials to go through that screening process to make sure that we are able to contain any potential situation there. A further 2 prison officers have tested positive, so that makes a total of 6. And in the screening process that was done yesterday, 3 prisoners were detected as positive cases. That is on the SD biosensor rapid test that we have been using. This was done out of a random process. The prison is divided into different areas, and so random process was done. And these 3 prisoners, one of them had been symptomatic the day before, and that's why that person was screened. And the immediate close contacts of this person were also screened, and they all turned out to be positive. Those samples are going to be further processed through a PCR screening process, and until that is done, then that's how you will see that reflected in the infographic. The preliminary data I have is that a further 90 persons, 90, are to be screened, swabbed, if they haven't been screened or swabbed today, but I don't have the report of what that screening process has entailed. The other subnote I have, and I think we have been getting a lot of calls and emails in terms of this, is for persons leaving the country of Belize. Understand that there is no requirement. We are not, from the Ministry of Health standpoint, requiring that you take a PCR test before you leave Belize. We are recommending that when you come back, if you can bring a PCR test, that expedites your process flow through the airport, notwithstanding that you may still be pulled aside to get a further PCR test or another rapid test, but that will be at the discretion of the quarantine authority at the airport. But we are recommending that you come back with a PCR test, but it's not a requirement from our end that you get a PCR test for you when you're leaving. I do know that some countries are requiring a PCR test, so understand that we are prioritizing who is getting screened for obvious reasons, because we don't have the ability to screen everybody leaving. So Belizeans who are leaving for essential reasons are top on the list, and essential reasons would basically entail people who are leaving because they have a medical condition that requires treatment outside of Belize, students or people who have who are employed outside of Belize and who are going back to where their work station is. So those persons would be routinely swabbed at no cost, and those samples are routinely processed only on Thursdays on a specific platform. Once that result is out, we will be providing you with an official letter that's signed and stamped by through the Office of Director of Health Services. So that's a pretty much straightforward situation. We may consider other situations on a case-by-case basis, but again, we are not really going to be considering doing swabbing for persons who show up at facilities on Saturday, Sunday, or any other day other than the day we have anticipated is going to be. And if you don't fall in any of the categories that I have mentioned, then as may be determined, you may be asked to pay the fee which has been agreed upon of $100 for that PCR test to be done for special purposes. As I said, there's a specific template, a specific form, and that is what we are routinely following for everybody. What you will be required whenever you send the email to the email address that we have been publicizing, which is dhsoffice@health.gov.bz, is you will be required to submit proof of the school you are going to, your travel itinerary, and who is actually requesting the PCR test. And I'm saying this because we have been getting people who are saying that they need it, and then we have found out later on that in point of fact it was not a requirement. People were just requesting it, and then we were trying to find them. We found out that they had not actually traveled, or that they had traveled to a different country than they had initially said in their email. In terms of the preliminary data for today, we have 67 positive cases. Good amount of those being in Belize district and the Orange Walk district. You'll get a further breakdown once we finish the infographic by should be around 6 p.m. Out of 306 samples processed, and we had preliminary 35 recovered cases. So that's what is in the data for today in terms of cases. The other note that I know is circulating extensively is what has happened in the Orange Walk situation. I met with the regional manager yesterday, and there's a team that went up there yesterday, and we had the health community and participation technical advisor is in Orange Walk today, because we have been revisiting what has been happening and what's going on in Orange Walk. When we look at the data that we have, there's multiple reasons why the situation in Orange Walk doesn't seem to go down. We have situations that are in rural communities in Orange Walk and situations in urban Orange Walk, and they are all different reasons. You have many social factors as to why people don't necessarily seek attention promptly. Some of it is driven also by fear. People are still fearful of finding out that they have COVID-19. Some people have been very straightforward and saying, I don't think I have COVID-19, I don't know anybody, and people, even though they are symptomatic, are still not coming into the health facility. We have been making diagnoses in persons who 5-6 days later are still coming back to tell us that they don't believe they have COVID-19, they believe they have something else, and so they are not accepting the diagnosis. I had the regional manager talk to a family member, and those calls are logged for more than 47 minutes in one instance, trying to explain to the family the importance of getting others to come in even though people are symptomatic. There's levels of stigmatization still happening, so people feel that they are going to be stigmatized, or they are being stigmatized because of what they have, either from their neighbors, from their peers, workplace, or their own family. So that is part of the factor that is driving people having late access to the health services. As I had mentioned, there are social determinants. Some people may not have the ability or don't have a stable workplace, so they basically work on a day-to-day, week-to-week situation. So people will tell you upfront that they don't want to be tested, because even if they are positive, then that means they probably will be placed on quarantine for 2 weeks, and that's time that they feel they cannot afford, not knowing what other avenues may exist. Or even when people may be positive, it's not that people want to come out and socialize and break the quarantine, but as soon as people start feeling better, they may come out, and again, because of other factors that are attached there. There's also a poor adherence to the prevention measures that we have asked to be implemented. The not more than 10 persons congregating in any given place, that we still see photos. We saw photos of a funeral just, I believe, yesterday, where it's evident that more than 10 persons were there. And these things, through the weekend, we saw it down south. People are still gathering. People are still having wake or repast 2-3 days, and more than 10 persons. Alcohol is involved. There's no mask wearing. There's no physical distancing. So there's really no end in sight until we really get serious about these prevention measures, because I can be here explaining this over and over again. People in Orange Walk can be out on the street explaining it over and over again, and it's not going to go anywhere if people on the ground are not implementing these measures. And I'm saying this because part of the strategy in some villages has been the involvement of NAVCO and village councils to go even using a bullhorn, giving it in the language that people can understand around the village, around the community, to get the message across, trying to get it even in Espanol so that people can understand. And it's not an easy process, because it doesn't seem that the message is really trickling back anywhere. I think they still fear more of the fine, the $5,000 fine. So you have people wearing a mask very improperly. simply because of the situation that there's a fine attached to it more than the concern of SARS-CoV-2. The interventions from the health standpoint, I think have changed as we have moved along. As I had mentioned, they have been sweep in some workplaces in rural communities. I mean, the Agos Pine Ridge, where 60 persons were swabbed, 6 persons identified. But you also have people coming up and telling you, I don't want to be tested, even though the testing has gone to the different communities. It's not everybody is willingly accepting the measures that are in place. In discussions with the management team, we did go back and review what are all those multifactorial matters that need to be addressed. Understand also that there's components that are related to every individual person. Obesity, hypertension, and diabetes are the key factors that are contributing towards having mortality and morbidity associated to SARS-CoV-2. With the 4 deaths yesterday, our rates went up to 1.5%. It is still only when you compare it to other countries, and again, I keep saying that any single death to us, we go back and review, and it's a cause for concern. But when you compare it to our neighbors immediately up north, they are hovering around 11 to 13% mortality. Our one is around 1.5%, but notwithstanding that is still significant. Now again, you go back and review the data as to why it is that people are dying. As I said, not everybody is going to necessarily die of acute respiratory failure. For example, of the 4 patients that died yesterday, only one of those persons was ventilated. The other 3 just had acute thrombotic conditions such as myocardial infarctions, strokes. Those are the primary driving factors. We also went back to review just this morning the data of what are the main reasons why people are dying, in case we are missing situations in people older than 65. What is the primary reason why people would be dying? And we have to go and maybe draft up a memo that all these persons who are having sudden death or dying of myocardial infarctions and strokes should be swabbed as a matter of routine now. But just so that you know, we have multiple causes of death. Of course, congestive heart failure, heart disease, hepatic failure, diabetic complications, sepsis. All of these are reasons why people are dying. But of course, in some of these instances, it is COVID-19 that is the common denominator, if you will. So we really cannot shy away from that. We are noticing that some people are also not known diabetics or not known persons to have had high blood pressure. We are making the diagnosis almost the same time as the diagnosis of SARS-CoV-2, or at least the patients are seemingly not aware, or even if they were aware, these are persons who got the diagnosis and never had interaction with the health system until they come back complicated. We are also noticing that patients are lying, and I'm saying this because we have had patients who have been swabbed. We have had pregnant women who have been swabbed because they have been in contact. They show up at the health facility. They don't inform anybody, and sometimes they're about to deliver. So you go through that process, you go back and check in the system and realize that they are positive for SARS-CoV-2. That's a situation that puts people at an extra layer of risk, because then the healthcare worker doesn't take all the other necessary precautions when you have SARS-CoV-2. So it's multiple factors. I know that it's not easy for us to be able to address it from just the Ministry of Health standpoint. As I reiterated to the regional manager, this requires an ongoing, and you have to go back to the table every week to review, re-strategize, and come back and have a dynamic process for us to what you do with situations that are starting to come up. We're also following the situation of dengue, particularly in Orange Walk, because the co-infection there, we can see a potential increase there. So that's something that needs to be monitored rather closely. As to piggyback on that situation with Orange Walk, the issue with the BDF group of BDF soldiers that have been stationed in Orange Walk. Some of the numbers that you saw there, it's at least 27 from that group that was stationed in Orange Walk turned out positive from that BDF group. So just so that you are aware, the majority of them are being quarantined now, I am told, in Belmopan, but up to about 60 of those had actually been swabbed, but 27 of them have been confirmed to be positive, and they are being isolated elsewhere. We have also 14 police officers that are currently listed as active cases of SARS-CoV-2, and I am not so sure if that entails or includes the 3 new officers from a specific group in the Cayo district that turned out positive this morning. So that's exposure frontline workers, and we also have 4 healthcare workers that are currently having an active case of SARS-CoV-2. In terms of 2 other notes I have is the flu vaccine. We put out a press release earlier in the week, I believe it was yesterday. 40,000 doses were procured by the government as part of the government funds. It's, the total investment is around 170,000 Belize dollars for those 40,000 doses. Mind you that this only entails the actual vaccine. The cost is higher than that because once you factor in the other materials, needles, cotton, human resources, then you have to factor what the cost is of getting a flu vaccine. Those are available free of cost at the public health facilities. Again, initially we are targeting the same high-risk groups that we have traditionally had, and obviously in the context of SARS-CoV-2, this group becomes of greater relevance. To stress that this flu vaccine is not going to protect you against SARS-CoV-2, it protects you against the more common flu viruses that you have. But if you have the flu and SARS-CoV-2, you have double viral infection. You can understand what higher risk you have of being hospitalized and getting complicated. So at least it's going to cover the majority of the other flu vaccines. So the invitation is for people who are particularly at high risk, people who are older than 60, diabetics, people who have high blood pressure, cancer patients, HIV patients, people who are taking chronic medications for rheumatoid arthritis, all those other chronic conditions. Those are the first group of persons we want to be able to reach, and children under 23 months of age. In terms of the COVAX facility, frontline workers, before I forget as well, I think we started with the vaccines yesterday with healthcare workers. We will see what the uptake is this year, because traditionally we don't get a good coverage or an anticipated coverage in frontline workers. We'll see how that goes. In terms of the COVAX facility and access to the specific SARS-CoV-2 vaccine, the estimated cost of that is around 5 million Belize dollars. That's the commitment that we were asked to hand in. That has been completed. The deadline was actually the 9th, which was on Friday, but that has been completed from our end in Belize. Understand that it will be perhaps the 3rd trimester of 2021 when that would be available, and in the first instance it would be available for 20 to 30% of a country's population. So we are anticipating that the same mechanism that we have for those who are more vulnerable, like what we use for the flu vaccine, would be the ones that we would be routinely using, or those be the initial targets, and the frontline workers and the populations that I listed that we currently use for the flu vaccine. Now, even if you get for 20% of the population, maybe if you want to do an inference here, 40,000 vaccines is really 10% coverage of your population. So if you get 20% coverage, and we'll have to see what the uptake is, because we have already been told by certain sectors that they are not necessarily going to be interested in promoting the use of the SARS-CoV-2 vaccine. So those are my notes. I will, I think, go and start addressing questions that may be coming up. Can you comment on the 4 deaths yesterday and that increasingly COVID victims are not reaching the KHMH ICU COVID unit but dying at regional hospitals and at home? Yeah, well, part of what I said has to do with the factors that people are determining. I know that we have had at least 2 persons die at Northern Regional Hospital saying that they are not coming to Carlushna. They have refused to be referred to Carlushna. I know of at least 2 persons who actually asked to be discharged from the Northern Regional Hospital because they did not want to stay there, and they decided that they were going to go out and rent the oxygen tank so that they could get supplemental oxygen at home, and then they were brought back basically to die at the regional hospital. Those factors are factors that I think are driven by fear, by misinformation. I know of a person who died in the Cayo district who refused to go. He knew he was in severe respiratory distress and basically said, if I go, I know I will be hooked up to a ventilator and I'm not going to go. So persons are having respiratory distress, and the other person that died from Cayo, I know, refused to seek medical care until he was really literally gasping for air. That's when he arrived, referred all the way to Carlushna. As soon as he got there, got intubated and was 2 weeks hooked up to a ventilator. Of course, the sooner you are able to do an intervention, the less likely it is that you're going to have the poorer outcome that we seem to be having. So it has to be part of an educational process, but I don't know how you're going to get over that hurdle of people not even wanting to be tested. I know of a particular family where the person died was confirmed as COVID-19. They are still refusing and debating to date that their relative died of SARS-CoV-2. They have had a second relative die of SARS-CoV-2, and the other family members that are ill are still not accessing health services, notwithstanding that health is trying to bring them on board because you want to avoid those communications. And the other factors that we all know, I have mentioned it, is we are noticing people having chronic diseases, poorly controlled diabetes, or people who did not know they were diabetics until they show up critically ill and you make the diagnosis. People who are known to have high blood pressure and are either not taking medication, are not accessing health care, or people that did not know. So these other factors, I mean, and this is not only specific to COVID-19. I said we are noticing that, and I was reviewing my data. I think we also have had, aside from COVID-19, 12 other myocardial infarctions across the country from the 1st of August to the 5th of October, which is 2 days ago. That's 2 months. You have had 12 people die from myocardial infarctions, not COVID-19 related. So you balance that and you realize that people also should not be dying as a result of SARS-CoV-2. So if you are not having a properly controlled diabetes, properly controlled high blood pressure, then the risk factor is just exponential. Those are the factors that are at play in the persons. As I said, it has to be part of an ongoing educational process, trying to engage persons early so that they seek medical care promptly. Because if not, then I think this issue will continue to repeat itself. How does the airport know the PCR test in hand is authentic? Well, I know that the quarantine officers there are very creative, and they have their ways and means of checking. The person who was picked up, by the way, brought in not a PCR test, a nucleic acid test. That did not satisfy the quarantine officer. And again, they will interrogate you, because if you have other risk factors, where you're coming from, whether you've been in contact with anybody, if you have any fever, or they detect you have a little bit of a cough and cold, then they will walk you through a separate process. So this person was picked up, notwithstanding that nucleic acid test, with a rapid test that has been confirmed with a PCR. So they will find their way. And even if they feel at any point in time that you are trying to run it past them, then they will give you an SD biosensor test, and they more than likely will give you another PCR test so that you get 2 tests at the airport. What happens if a single parent is positive and the child needs testing? Well, we are routinely testing everybody. I know that in the flights that arrived, their quarantine officer makes a determination. If you have 5 people from a family coming, they might not test 1 or 2 of their children. That's at the discretion of the quarantine officer. But understand that we have tested children as young as newborns when they were born to mothers who were confirmed positive. So the age of the child isn't really a determining factor. If the quarantine officer on the ground determines that you need to be tested regardless of the age of the child, then that test will be done. That's part of the process and protocol. So that is that. Now, if the question is what happens with the single parent who is positive and the child is negative, because we have had that, I think 3 cases at least of where that happens, we can make a determination as to where the quarantine of the adult is going to be. If there are any more adults in the group, if there's any other family member the child can go to. But understand that if the adult is positive and the child is negative, whoever takes the child will also have to go and do quarantine, because you don't know if that child will later on turn out to be negative. So there's many factors that are determined on a case-by-case basis by the quarantine officer at the airport. If a returning property owner or long-term resident or anyone decides that they really don't want to obey the rules on quarantine and think they can just wander on their local community, who is there to enforce the restrictions? As I said, it is clearly articulated in the SI. It's 3 months imprisonment is what it calls for, plus mandatory quarantine at the discretion or enforced by the Ministry of Health. I don't know that we should be entertaining this. And I think I need to also be very careful and be very come across as this is a strong message I want to bring across to everybody. The rules in Belize are to be enforced. It really doesn't matter where you come from, what your belief is, because I know some people don't believe in mask wearing or the physical distancing. When I go to a different jurisdiction, I have to be guided by the rules, laws, and regulations of that country. It's the same thing here. So wherever you're coming from, even if not a Belizean, don't think that the laws don't apply to you. And I think we're seeing a lot of that play in terms of what's happening in Placencia. So in communication I had with a couple of persons, we said just send us the note of who the person is, and we intend to enforce the SI, which means if people have to go to jail so that the message gets across, then that is where we intend this to go. In regards to masks, do outside maintenance workers on private properties, condo complexes, landscaping, power washing, painting, yard work have to wear their masks at all times, even if they are the only one outside on the property? Well, if you're power washing, painting, I would wear a mask, not necessarily because of COVID-19, but because I think whatever I am exposed to can be a potential situation. If you're on a private property, you really don't have to wear a mask. I still think it's recommendable. But I also see driving up on people doing construction on the highway, nobody really seems to be wearing a mask. And you have people, all groups of people mingling, and I'm sure they come from different backgrounds, different geographical areas. Those persons really need to be wearing a mask. Right? It's whenever your protection is against others and you protecting others. I think that needs to continue to be enforced. If someone from a small office tested positive, should the other workers in the office be tested? It depends on your level of exposure. I anticipate that you are trying to keep your physical distance at the maximum. Understand that if a small office, it probably doesn't work. But I anticipate that everybody will be wearing a mask to minimize your risk. So it depends on the layout. It depends on whether you have an enclosed area where there's AC, whether you're out in the open, how many people are there, and what your level of exposure is. And that is determined by whenever the interview is done. So it doesn't make it automatic. And I'm saying this also because I know some of the employers are actually telling their employees just sending them away and saying you go and get tested and don't come back until the result is negative. There's a process for that, and what we want to do is encourage the employers to make sure that that is enforced at all times, instead of just sending people to be tested and knowing that that's not necessarily how it's going to work. When you come into the airport, how do you get clearance from after the 10 days? This is a very I think it's a very valid question, because people are saying, okay, how do I know I have been cleared by the relevant authorities? So we are looking at how we're going to do as of tomorrow. We're considering maybe even putting a different color wristband, and that persons would go to the nearest either health facility or police station to get it cleared up there, but we have not gone through that process yet. So that's part of the ongoing discussions that we are having. If someone comes to pick up someone to take back to the US, will she or he be required to do the 10 days quarantine before leaving the country with the person? I'm not too clear what that means. If someone comes to pick up someone to take back to the US, okay. Will he or she be required to do 10 days quarantine before leaving the country with the person? Yes, you can't go anywhere. I mean, now this is important, because people are saying, what happens if I come 5-7 days only because it's a short stay? Then you have not met the quarantine period for you to be out anywhere. Can she leave the country within 3 days? Technically you can, but you within those 3 days quarantine period, you can't go nowhere. So you might be able to go to wherever you're going to do your quarantine and then go back out. I think that's feasible and plausible, but not to be going out anywhere for now. Are we testing all persons who have the COVID-related diseases? As I said, not everybody. That's part of the data we are reviewing, and we are considering that will be an internal memo that will circulate, so that we have any person dying of an acute myocardial infarction or any other situation, that we would be able to swab them, so that we get a better grasp of what potential role COVID-19 is playing in all these diseases. What's the update from the Colby Foundation? I think I already gave that at the beginning of my notes. How long does the process take from arrival to clearance from the PGIA? On average, when there were 2 flights, the max it took was 2 hours and 3 minutes, I think, to clear the 200 plus persons. Of course, if you have a PCR test, it is more than likely that you will go through that process quicker. It doesn't mean that you will not be delayed by a further test, because, as I said, at the discretion of the health official there, you may be subjected to another PCR test or a rapid test, or both. But if you bring up a PCR test within 72 hours, it's more than likely that you will go through the process much quicker than if you don't bring any test. So if you don't bring any test, that's what the process will look like. Current situation at Karl Huchner with hospitalized COVID-19 cases and suspect cases. 8 confirmed cases at Karl Huchner, so that their COVID-19 unit is now full. 2 of those patients are intubated. The other 6 are either on high flow of oxygen and not requiring ventilation for now. That's what we have at Karl Huchner. One of those 2 patients ventilated, we were told earlier, is very unstable, so it's not looking good. The prognosis doesn't look that good. Has an intubated patient been successfully extubated? We had 2 persons who were extubated. One person died 48 hours after being extubated of a cardiac condition that happened, and the other person is recovering slowly at home, because as it has been described in the literature everywhere else, people who recover from COVID-19 have a long recovery process because of disrupted pulmonary function, disrupted cardiac function, and mental situations that patients go through after they have been in an ICU and ventilated. Can someone in a gold star hotel exit into the community after a period of 10-day quarantine? That should be addressed when you come in. You need to clearly specify what it is that you're going to be doing, because you would then not be classified as being in a gold standard or a gold standard hotel, not gold star, gold standard hotel. So that it says what it is that you're going to be doing and when you're able to go wherever you're able to go. So that should have been said from when you came in. How can patients access the flu vaccine? Do they just walk in and ask for it? Yeah, you can go to the public facilities. It is free. To the public health clinics. The best bet would be if you can call ahead of time, because they may have a specific time that they are giving it, because this is the same group of nurses that offer services to maternal and child health and sometimes go out and do mobile clinics. So if you call ahead of time, that would help everybody, and it may delay your process, may expedite your process of getting that flu shot. I know many elderly persons who want the vaccine but are afraid of going to the public health facilities due to a high number of COVID cases. Precisely that, if you call ahead of time, that process can be made much smoother, and it doesn't really give you the flu as what most people think. It gives you a little bit of a arm ache. I got my flu shot yesterday, and I survived, so I think everybody else will survive. What is the projected number of total active cases based on the global infection rate and mortality ratios? That's a very difficult question. I don't know if there's a straight answer. I can tell you that we, from the Ministry of Health standpoint, were anticipating that we were going to see surge in cases, which means that we really haven't plateaued in the current wave when it started back in the third week of July. We are still increasing cases. The positivity rate of samples processed dipped a little in the second week of September, but it has gone up again. It's hovering between 18 to 23% of cases, and I don't know that it's going to go down anytime soon. But we are anticipating that with the flu season coming on, we may very well be having a further surge, if you will, towards the second portion of November into December and maybe early January. And I can't say that it's related to the airport situation. Look at the numbers that we are getting over the last week. The numbers not related to the airport situation have just been gradually increasing, if you will. Is it allowed for more than 10 persons to be at the workplace at one specific department? Isn't rotation recommended to the employers? I think this is still happening. I know some people are being accommodated to work from home and they are doing a rotation. You will have to get creative because SARS-CoV-2 is not going to go anywhere. I think even at banks and major businesses, they're doing rotation of their staff. Similar situation here. That's where we are at. Even at headquarters, I think we try to rotate people who want to go on vacation. Those kinds of situations are being accommodated for. Is it true that positive patients no longer need 2 negative tests to come out of quarantine? Yes, that has been in place for probably 7 weeks now. So 1 negative test and you are declared negative, and you are able to, you're declared as a negative case by Ministry of Health, and you are able to leave the quarantine process. How about opening the land border only to Belizeans to return and do a rapid test and quarantine until the efficient PCR test is done for him or her? We are trying to work on that. The issue there is we don't have the health staff to be manning rapid tests at the border entry points. The way it has routinely been working is we send staff from the Corozal hospital and from the San Ignacio hospital to go to pick up these persons when they are arriving. One of the discussions I had with chair of the task force earlier today is we may be able to work towards this specific request, but we are anticipating that the way we would do this is, you plan for the airport when the plane is going to land. You know the amount of people that are landing. You get their manifest before time. we may very well need to move towards that, so that when we go to the border, then it's one specific day, one specific time, and we are able to clear everybody, maybe with a rapid test, and then ask them to go and get a PCR test closer to home around day 7. That's something that we are looking at, but for now we are not doing rapid testing at the border, because it's not, just so you know, for example, in Corozal, the actual swab is not done at the entry point. You're brought to the Corozal hospital and then taken to the hotel to wait for your quarantine. Similar in San Ignacio, they bring you to the San Ignacio hospital and then you go to the hotel in the Cayo area. So it's a work in progress. I mean, we're trying to accommodate everybody, but it's not that easy. As I said, if you bring your PCR test, that as we move along should be able to expedite your process and make it much quicker. I believe those are all the questions we have. We really thank you very much for listening to the notes that we have. I know that we are concerned about the situation in Orange Walk. We are following that very closely, but understand that there's multiple factors playing there. Understand that if we are going to be able to curtail this, it will require not only a Ministry of Health effort, but really the entire community would need to remain engaged. We have seen the proactive approach that some communities